Welcome to the Food Service Video Training Series. This video covers food allergen management. This video covers what a food allergy is, symptoms of a food allergy in Australia, what foods contain allergens, legal requirements and food allergen management. A food allergy is an immune response to a food protein that the body mistakenly thinks is harmful. When a person eats food containing that protein, the immune system releases a huge amount of chemicals. This triggers symptoms that can affect a person's breathing, gastrointestinal tract, skin or heart. When this happens, the person shows symptoms of the food allergy. There is no cure for a food allergy. The only successful method to manage a food allergy is avoidance of all foods containing the allergen. A food allergy is not the same as a food intolerance. A food intolerance is the inability of the body to properly digest or fully process certain foods. This can cause discomfort and distress, but is not life-threatening. The most common intolerances include lactose, gluten, yeast and sulfites. Food allergy symptoms vary from person to person, and reactions can happen quickly after eating. Symptoms can include hives, swelling of the lips, face, eyes and tongue, tightness of the throat, breathing difficulty, abdominal pain, vomiting, dizziness and collapse. The most severe symptom is anaphylaxis, and is a medical emergency. A severe reaction can be fatal. So how big an issue are food allergies in Australia? It is estimated that food allergy affects around 1 in 20 children under 5, and about 1 in 50 adults. Food-induced anaphylaxis has doubled in the last 10 years, and approximately 10 people die from anaphylactic reaction each year in Australia. There are 11 foods that cause around 90% of all food allergic reactions. These are peanuts, tree nuts, for example almonds and cashew nuts, eggs, milk, fish, crustacea, for example prawns and lobster, sesame seeds, soy, cereals containing gluten, this is wheat, rye, barley, oats and spelt, sulfites when their concentration is 10 mg per kilogram or more, and lupin. However, there are hundreds of other foods people can be allergic to.
That's right. There are more than 170 foods known to have triggered severe allergic reactions.
Food allergens can be present in many food ingredients, and are not always obvious from their name.
For example, vegetable oil may contain soy, peanut or sesame.
By law, manufacturers must declare all the 11 allergens previously mentioned in the ingredient list on food labels. A declaration is required when these foods or substances may be present as an ingredient or compound of an ingredient, or a substance used as a food additive, or an ingredient or component of such a substance, or a substance used as a processing aid, or an ingredient component of such a substance or food. In addition, consumers have a legal right to receive on request, written or verbal information on allergen content. Now let's look at food allergy management. In 2018, the statewide Food Service Network launched a food service best practice guideline for managing food allergies. The guideline outlines the steps for food allergen management in Queensland health facilities. Let's take a closer look at some aspects of the guideline. It's important you know your ingredients so you can identify allergens. A food allergen matrix is a tool that can help you keep on top of this. A food allergen matrix lists your meals and ingredients, and for each of them shows which of the 11 reportable allergens are in them. You can also add additional allergens to the matrix if needed. The matrix should be reviewed after a change, or each year. Most importantly, it should be accessible by everyone. Here's an example of a food allergen matrix. It's also important that ingredient substitution is kept to a minimum. If you are substituting any ingredients, changes should be approved by a dietitian, your manager, or another suitably trained person. Also ensure that you have standard recipes, and these are followed. Do not add or change ingredients as it can impact the allergens in the meal, and impact patient safety. It's also important to avoid cross-contamination. Cross-contamination occurs when food containing allergens comes into contact with food that does not. Examples might include a food handler using the same cutting board to cut an egg sandwich, and then a ham sandwich without cleaning down in between, or a cook preparing cooked fish on a plate, then preparing a vegetable dish without washing their hands properly. Or, a food server using a utensil to serve fish, then using the same utensil to serve chicken. You can help avoid cross-contamination by ensuring you handle all food safely. Be familiar with your food safety plan. Clean and sanitize work surfaces, utensils and other food contact items between foods, as even small amounts can be harmful. Store food safely and label clearly. Have some way of identifying the meals for people with a food allergy. And check the person with a food allergy gets the correct meal. Lastly, it's important we listen to our patients and residents. Take all allergen requests seriously, and ensure that any reported food allergy is recorded correctly, and communicated appropriately to the kitchen. How this is done will vary depending on where you work. It's your responsibility to know what the process is. Provide patients and residents with accurate information about the allergen content of meals when asked, and ensure you are clear on what foods are involved. You cannot guarantee allergy-free food, but you can do your best to make sure the allergen is not an ingredient of any component of the menu item chosen. Here's a checklist of things you should know or go and find out about. Firstly, the food allergen management plan where you work. This may be part of your food safety plan. Next, know what aspects of food allergen management you need to be aware of for your role. Make sure you know where to find information about food allergens in your meals. Find out if there is a food allergen matrix. Lastly, find out who is the food allergen management contact where you work. Is it your manager, or your dietitian, or someone else who is suitably trained? That's it. Let's recap what we've covered. We've talked about what a food allergy is, symptoms of a food allergy, and the scale of food allergy in Australia. We then looked at what foods contain allergens, the legal requirements for food allergens and food allergen management. Thanks for watching the video. Take a few moments to think about how what you've learned can help you in your role.